Good morning, I'm Dr. Timothy Douglas from Douglas Chiropractic here in beautiful Destin, Florida. Today's Tuesday, August 19th, and I'd like to review a special reflex that can cause lower back, hip, leg pain, sciatica, knee problems, and foot problems. It's called the head on neck righting reflex. So when the head comes off its vertical axis, the brain doesn't like that. The eyes should be level with the horizon. So what will happen, the neck starts to stiffen up and your shoulders will get harder to breathe. It's harder for the heart to pump blood from the heart to the brain. And so what will happen is the lower back and the hip will shift, creating better realignment up here, but it causes tension in the lower back. It's one of the reasons, my opinion, why low back surgery, which has a failure rate now between 50% and 75%, unfortunately, is because they're looking at the lower back. I work with some fine surgeons and we'll work with realigning the body and making sure they're doing prehab, making sure the muscles of the core and the throughout your back and flexibility of the legs and throughout your whole body is good before surgery, or best as we can. So when they do their work, and if it has to be a fusion, whatever the type of discectomy, whatever they're doing, they're going to have better circulation and the recovery will be better. So head on neck righting reflex is when the head comes off its vertical axis. The hip and low back will shift, creating a great deal of tension in the lower back. On the spine, last week we looked about when the head starts going forward. When the head is going forward, working at a desk or driving creates a lot of a strain. A 10-pound head, average head is 10 to 15 pounds, becomes 20, 30 or more pounds. A lot of stress into the upper shoulders and all the way down to the lower back. There should be a natural arch. In this position here, when the head comes off, usually to the side of handedness, the hip will shift, creating a great deal of tension. So I'd like you to give us a call today at the office at 850-650-6789. Get a complimentary posture evaluation. If you'd like to get a second opinion on an MRI, we'd love to do that. And remember, we've got your back.